Hi, my name is Julian and I will be taking the role of the patient for our assignment.
Hi, my name is Maddie and I'm going to be taking the role of Piper, the patient's family member.
Hi, I'm Megan and I'm going to be directing and writing scripts and taking the introduction.
Hi, my name is Mayar and I'm going to be playing the role of a student nurse.
Hi, my name is Nora and I'm also going to be taking the role of the student nurse.
Okay, so our patient's name is Anne Smith. She's presenting with chronic constipation over the course of 3 to 4 years. She's tried multiple doctors with no luck. She's got a lot of bloating and gas and pain that's affecting her daily life, and she's coming here for answers.
Hello, my name is Mayar and I'm going to be a student nurse today. Can I start off by having your name here?
I'm Anne Smith and this is my sister Piper.
I'm going to be asking you about some health questions. Is that alright with you?
Yes, that's alright.
Sounds good. What brings you in today?
I'm having severe constipation and gas wouldn't pass through and there's the bloating, it's just giving me so much discomfort.
Has this happened to you before?
It's been 4 years since I've gotten this. I've gotten treated but never really have an answer for what's causing it.
Okay, that doesn't sound good. Do you take any medication for it?
I'm taking Gravol to help with the bloating, but it comes to relief, but then just the pain returns.
How often do you take this medication? Or did you take it at all today?
I took the Gravol medicine this morning before I came here.
And how much do you usually take every day?
Just whatever is in the bottle, the appropriate amount. Yeah.
Sounds good. Do you have any allergies at all towards food?
I don't have any food allergies, but I am allergic to latex.
Latex, okay. Are you allergic to any medication at all?
Oh no, I'm not.
Do you take any medication other than Gravol?
No, Gravol would be the only medication.
Did you have any significant childhood illnesses at all?
I had asthma when I was a kid, so I've been using inhaler, but it's only it's kind of like a seasonal thing, the asthma, so yeah.
Do you use this inhaler every day?
Only seasonally because I don't have asthma on a daily basis, but it depends on the weather and stuff.
Okay, sounds good. Have you ever been hospitalized?
I had a concussion when I was 14 years old due to a jumping incident.
Sounds good.
Mom was so mad at you.
When you come in contact with latex, what happens?
I just get a really bad rash and the itchiness and the redness all over my body, wherever the latex come in contact with.
And do you take anything when you experience that?
For the latex, normally I would be in the hospital, but I am not sure what they would be giving me. I'm pretty sure they would have given me something.
They gave you Reactin that one time.
Oh yeah, that one.
Okay, sounds good. And during seasonal changes, how does it affect you?
For my asthma, normally the common symptoms, just shortness of breath, normally those kind of stuff. So that's when I use my inhaler.
Okay, sounds good. And are you up to date with your immunizations?
I believe all my immunizations are up to date as of the moment.
Except the COVID shot. Remember, we didn't take those.
Yeah,
we declined them.
Yes.
Okay, that's fair. And is there any illnesses in your family that I should know of?
My mom has type of diabetes and depression, and for my dad, he has a history of stroke and heart attacks.
Okay, I'm so sorry to hear that. And how's your social supports? Do you live with anyone? Are you active? Your hobbies?
I do therapy for my mental health because I have depression.
And we live together.
Yes, yeah.
Okay, so good. Do you smoke on the daily?
I smoke on the daily, but I don't have time to go to the gym. But I try to walk. Those are my activities normally. Yeah.
Sometimes we walk our dog together.
Okay, sounds good. Do you take any recreational drugs?
No, I don't.
Sounds good. Do you drink alcohol often?
I drink it occasionally.
Have you guys traveled anywhere recently?
We just came back from Cancun, actually.
Did you just go there for fun, or did you receive any health care while there?
We only went there for recreational purposes, and I was not hospitalized at all.
Okay, sounds good. And with your spiritual beliefs, is there anything I should know about it?
I am Jehovah's Witness, so of course I cannot take blood.
Okay, that's fair. Sounds good. Other than Mexico, have you had a well-balanced diet?
I usually just eat fast food because I have long hours of shift, like every time I go to work.
And you say you have long hours of shift. Have you been able to work?
I haven't been able to work this past couple of days because like my digestive thing was like just not working out. It's just causing me a lot of pain.
She hasn't left the couch in 3 days.
Yeah.
That sounds so stressful. Do you have any other recent stressors in life?
My financials right now are not in a good place. I only have like solo income, so like the work-life balance is not working out for me at all.
Well, it must be so hard for you. What do you do for work?
I'm a bus driver.
Okay, and well, that's all I have for you for now. I know that another student, nurse Nora, is gonna come here and do a pain assessment on you soon.
Hi there, my name is Nora. I'm going to be your student nurse for today. I'm just here to do a pain assessment on you. Is that all right?
Yeah, thanks.
Okay, I'm just going to start off by taking a look at your wristband. Can you just let me know your name?
And Smith,
Okay, and then just your date of birth?
May 16, 2006.
Okay, awesome. And then do you know where you are?
Yes, I'm in Largos Hospital.
Yeah, okay, sounds good. Okay, so on your chart, I just want to double check. You have an allergy to latex. It causes like irritation, itchiness. Is that correct?
Yes, that's correct.
Okay, and then you also have seasonal allergies, kind of like you flare up, got to use your inhaler, shortness of breath, all those good things.
Yes.
Yeah. Okay. Alrighty. Okay. I'm just gonna talk about your pain a little bit here. Can you tell me when the pain first started?
It started about 5 days ago.
5 days ago? Okay. And does anything kind of like make it worse? Does it make it better? Like sitting for long amount of times or? Yeah.
Well, the gravel was helping a little bit.
The gravel was helping, but it just gets worse when I sit for long periods. It doesn't help that I'm a bus driver.
Okay.
It feels slightly better when I'm passing gas or having a bowel movement.
Okay, totally. For the pain, do you find that it's like a stabbing? Do you find like it's pressure? Like, what would you describe your pain to be?
More like it's just the pressure. And
Pressure?
Yeah, because like just the bloating and like everything.
Okay. Okay. And on the pain scale, so 0 being like or like no pain at all, 10 being absolute worst pain of your life, can you rate your pain for me?
Just about 7 out of 10.
7 out of 10?
Yes.
Okay. And if we can get your pain down, what would be a manageable number that we could do?
4 would be good.
Yeah, just something to kind of like ease it.
Exactly, yes.
Okay. And can you just like point or show me exactly where the pain is?
Just about in my lower abdomen.
Lower abdomen. And then do you find that it like moves up, like radiates towards or like down towards kind of like your pelvis?
Doesn't move anywhere.
Okay. And can you tell me what you think is causing the pain?
Just picking up extra nurses, I haven't been eating well or doing much.
Okay, so you kind of feel like that's kind of like backing things up a little bit?
Yeah, I believe so.
Yeah, okay. And then treatment-wise, do you find like anything helps, or have you had any treatment or taking like constant medication?
I've tried stool softeners and
Okay.
I've put on laxatives.
Okay.
I've also went to different kind of doctors, but nothing has been successful at all.
Okay. And for the laxatives and the stool softeners, do you have any relief with them at all, or?
Like from time to time, yes, there has been a relief because there's technically it's passing gas and like bowel movement is there, but the pain just comes again.
Okay, totally. So we'll see what we can do for that. Okay. I'm just gonna run out of the room. I'm just gonna grab some supplies to take your vital signs, and then we can go from there. Is that okay with you?
Yes, that's
Okay, sounds good. I'll be right back. Okay, so your vital signs all look great. I'm just going to palpitate and oscillate.
What does that mean actually?
So to palpitate is kind of just feeling things, making sure there's no like abnormalities, make sure everything's feeling okay. And then to auscultate is really just listening with my stethoscope to make sure everything sounds okay.
Oh, I guess that's fine then.
Okay, perfect. I'm just gonna start by listening.
Want me to get out of the way?
That would be great, thank you. Okay, I'm just gonna start off by listening. You can just continue breathing as normal. Okay, thank you. And then I'm just going to do the same thing just with feeling. If anything like hurts, or you feel like an extensive amount of pain, just let me know. Is that okay?
Yes, that's okay.
What about here?
Yes, that's okay.
Okay. And here.
Yeah.
That you have pain there?
Yes, my lower abdomen.
You're okay. Okay. When I apply deeper pressure, is that where you feel it?
Yeah, normally yes.
Okay. And then I'm just gonna do here. What about over here?
No, just normally on the
Yeah, okay, so just on this side. Okay, sounds good. Thank you. Okay, so I have everything I need. I'm gonna step out. Mara will be in here to ask you a couple more questions. If you need anything, I'll be around.
Alright.
Okay, bye-bye. Thank you.
Oh, hey, what'd you find when assessing Anne Smith?
I have her chart here. So all her vital signs are pretty normal. Her temperature was 38.6 degrees Celsius. Her heart rate was 96 beats per minute. Respiratory rates were 18 breaths per minute. Blood pressure was 138/88. And then she's at a 98% for oxygen saturation on room air. And then when I went in to do my pain assessment, she looked like pretty okay. She did have some guarding when it came to palpating her stomach. Skin color looked okay. Yeah, just visible distension in that lower left quadrant. And then she seemed pretty alert. She's independent with her daily activities. Her BMI is nothing out of the ordinary. It's a 21.3. And then along with her skin color, there's no jaundice or cyanosis at all. The main thing was just the guarding in the lower left quadrant, so I think we just need to follow up on that just to see if there's anything deeper there.
Okay. Hello, Anne. How are you feeling?
Not bad, not bad. The same thing, yeah.
Okay, and would it be okay if I ask you a couple questions here?
Yes, for sure.
Okay. When was your last bowel movement?
I haven't been able to use the bathroom for about 6 days. I would explain the pain as cramping and feel like my belly is always full of gas.
Okay, and what did it look like?
Normally, I don't have like full bowel movement. Like if you just take like small amounts, and yeah, just like
So it's usually hard for you to go to.
Yeah, it's just like hard to go exactly.
Okay, I see. Have you experienced any nausea or vomiting recently?
I guess I've been a bit queasy. I didn't think anything of it. No vomiting though.
Okay. Okay, sounds good. That's all I have for you for now. I'll just let you rest for a little, and then maybe we'll bug you again in a little bit.
My name is Megan Basan. I'm one of the student nurses at Northwest College. The client that we are speaking about today is Anne Smith, a 20-year-old female. She's presenting with chronic constipation accompanied with painful bloating and gas, and that is what has brought her into the hospital today. So she's been dealing with chronic constipation for 3 to 4 years. Her job includes prolonged sitting, which worsens her symptoms. She has constipation, bloating, and pain. Patient has a history of asthma since her childhood and uses an inhaler as needed. It's unknown as to how much of the medication she takes at a time or when. Since childhood, she's been doing that. Concussion at 14 years old, was hospitalized for it. Patient self-medicates with Gravol to treat symptoms, unknown dosage and frequency. Patient is allergic to latex and gets a contact rash when exposed to latex. Patient smokes daily and does not eat a well-rounded diet due to her profession as a bus driver. Anne Smith, again, is a 20-year-old female presenting with acute chronic constipation and worsening abdominal pain. Her vital signs show a fever of 38.6, mildly elevated heart rate of 96 beats per minute, and slightly elevated blood pressure of 138/88, which may indicate inflammation or infection. She is alert and oriented by 4 times, but appears visibly uncomfortable with abdominal distension. Abdominal examination findings include visible bloating, distension, and hypoactive bowel sounds in the lower right quadrant, fewer than 5 sounds per minute. Sharp pain with light palpitation in the lower right quadrant with guarding and rigidity in the area. A palpable, movable 3 centimeter elongated mass in the lower right quadrant. Subjectively, the client reports severe constipation for 3 to 4 years, cramping abdominal pain rated at a 7 out of 10 at her worst pain, worsening with prolonged sitting, temporary relief after passing gas for her bowel movements, which are hard to pass. gas and bloating daily. She does smoke and have poor dietary habits as well as some nausea. Overall findings suggest fecal impaction, bowel obstruction, or another inflammatory gastrointestinal condition requiring further medical evaluation. It should be noted that Anne is a Jehovah's Witness and does not receive blood.